Varicose veins is an cardiovascular condition. Look at this picture, shows that normal legs and varicose veins legs. Doppler ultrasound images, look at this, to know blood flow. Photoplethysmography. Then MR venography. Look at this. Veins visualized. Detail going on. Introduction. Varicose veins are a common vascular condition characterized by swollen, twisted and enlarged veins, primarily affecting the lower extremities. They results from malfunctioning venous walls leading to improper blood flow and venous pooling. While varicose veins are often a cosmetic concern, they can sometimes lead to significant discomfort and complications if left untreated. Etymology. The term varicose veins originates from the Latin word vertex, meaning twisted or swollen, and refers to the enlarged, twisted veins typically occurring in the legs. Definition. Varicose veins are dilated, elongated and toothless veins caused by increased intraluminal pressure and wall incompetence, typically occurring in the superficial venous system of the legs. Types. 1. Primary varicose vein develop in the specifical veins due to weak vein walls or valves. 2. Secondary varicose vein occurring as a result of deep vein thrombosis, DVT, or other conditions affecting deep veins. Three. Reticular veins, smaller burst green veins that are less prominent. 4. Telangiectasious or spider veins, very small superficial veins that appear as red or blue, web-like patterns. Causes. 1. Valve dysfunction, primary cause due to venous valve incompetence. 2. Genetic predisposition, family history of varicose veins. 3. Prolonged standing or sitting increases venous pressure. 4. Pregnancy, hormonal changes and increased pelvic pressure. 5. Obesity adds strain to venous routine. 6. Trauma or surgery may damage venous walls. Risk factors. 1. Age, old individuals are at high risk. 2. Female gender due to hormonal influences. 3. Family history of varicose veins. 4. Obesity. 5. Sedentary lifestyle. 6. Occupations requiring prolonged standing or sitting. 7. History of DVT. Complications. 1. Chronic venous insufficiency. 2. Skin changes such as hyperpigmentation and eczema. 3. Venous ulcers, particularly around the ankles. 4. Superficial thrombophlebitis. 5. Bleeding from ruptured veins. Pathophysiology. Varicose veins develop from venous valves which prevent backflow of blood fail. This leads to retrograde blood flow and venous pooling. The increased pressure causes the veins to dilate and enlarge along it, forming the characteristics varicosities. Over time, chronic venous hypertension results in inflammation, tissue damage, and skin changes. Pathophysiology of varicose vein step-by-step process. 1. Valve dysfunction in veins. Veins have one-way valve that prevent blood from flowing backward. Damage or weakening of these valves leading to valve incompetence. 2. Venous reflux. When the valves fail, blood flows backward and pools in the veins, especially in the lower extremities where gravitational pressure is higher. 3. Increased venous pressure. The pooling of blood increases venous pressure, stretching and weakening the vein walls over time. 4. Venous dilatation. Prolonged increased pressure causes the vein walls to lose elasticity, resulting in dilatation and twisting. 5. Altered blood flow. Stresses develops in the affected veins, reducing the efficiency of circulation and promoting further pooling. 6. Inflammatory response. Stresses and venous hypertension trigger inflammation in the vein wall, leading to the recruitment of inflammatory cells and further damage to the valve and vein structure. 7. Structural changes. Chronic inflammation causes fibrosis of the vein walls and further loss of function, perpetuating the cycle of venous insufficiency. 8. Symptoms and complications. These changes result in visible varicosities, discomfort, heaviness, swelling, and complications such as skin changes, venous ulcers, or thrombophlebitis in severe cases. This case card highlights the interplay between mechanical dysfunction, hemodynamic changes, and inflammatory processes in the development of varicose veins. Signs and symptoms: 1. Visible swollen and twisted veins, commonly in the legs. 2. Aching or heavy feeling in the legs. 3. Swelling in the lower legs and ankles. 4. Pain or cramping in the legs, especially after prolonged standing. 5. Itching around the veins. 6. Skin discoloration or ulceration in severe cases. Diagnosis: 1. Physical examination, inspection of the legs for visible varicosities. 2. Doppler ultrasound to assess blood flow and valve function. 3. Venography, rarely used but it provides dilated vein images. 4. Photoplethysmography measures venous function. Nursing diagnosis: 1. Impaired physical mobility related to pain or discomfort in the legs. 2. Ineffective tissue perfusion related to venous insufficiency. 3. Risk for impaired skin integrity related to chronic venous stasis. 4. Disturbed body image related to visible varicosities. Management: medical management. 1. Compression therapy, use of compression sticking to improve blood flow. 2. Medications, pain relievers, anti-inflammatory drugs or venotonic agents. 3. Minimally invasive procedures, sclerotherapy, laser treatment, or radiofrequency ablation. 4. Surgery, vein stripping or ligation for severe cases. In nursing management: 1. Educate patients on lifestyle modifications, weight management, exercise. 2. Encourage leg elevation to improve venous return. 3. Promote the use of compression stockings. 4. Monitor for signs of complications, example ulcer. 5. Provide wound care for venous ulcers. 6. Support psychosocial well-being by addressing body image concerns. Treatment options: 1. Lifestyle modifications, exercise, weight loss, and avoiding prolonged standing or sitting. 2. Compression stockings, first line non invasive treatment. 3. Minimally invasive procedures. Sclerotherapy, chemical injection to collapse veins, endovenous thermal ablation using lasers or radiofrequency. 4. Surgical interventions reserved for severe cases including vein stripping or phyllolectomy. Psychosocial medicine. Varicose veins can affect self-esteem and body image, leading to emotional distress. Patients may experiencing anxiety, especially if the conditions impacts their mobility or daily activities. Counseling and support groups can help address these concerns. Important psychosocial medicines include 1. Cognitive behavioral therapy CBT, 2. Support groups, 3. Mindfulness based stress reduction, 4. Psychoeducation, 5. Motivational interviewing MI. Prevention. 1. Regular physical activity to improve circulation, 2. Maintaining a healthy weight, 3. Avoiding prolonged standing or sitting, 4. Wearing compression stocking when necessary, 5. Elevating leg periodically to reduce venous pressure. In conclusion, varicose veins are a manageable condition with proper medical and nursing interventions. Early diagnosis and treatment can prevent complications and improve the quality of life for affected individuals. Emphasizing prevention and patient education is crucial in reducing the incidence and impact of varicose veins. Thank you. Have a nice day.